Hi, my name is Caitriona. Welcome to the Bump Room. You're watching our blog on carpal tunnel syndrome. So what is carpal tunnel syndrome? It's a condition that can affect women during pregnancy. So if you're suffering with tingling in your fingers, any pain or stiffness in your fingers or hands, it probably could be that you're suffering with carpal tunnel syndrome. And what happens is that in pregnancy, the pregnancy hormones cause us to retain a little bit more fluid. So what happens is in this narrow passageway in our wrist where our tendons and our nerves are going through, that's called the carpal tunnel. So our nerves and our tendons are coming through there, particularly our median nerve. That's the one that generally becomes affected by increased fluid here. So it causes it to get squashed or compressed, and that can lead to this tingling finger sensation. Now this normally occurs later in pregnancy. Normally occurs in one, but some women will get it in both hands, and symptoms are usually worse at night. So what do you do if you have this? So if you are getting these symptoms, there are a few little things that might just help to relieve your symptoms. So what we do recommend is pumping the wrists regularly, okay? So just simple, just pumps like this, and just clenching and unclenching the fists like this, okay? And what that does is it just helps to get fluid pumping through and reduce the swelling in and around the wrist. The other thing that can help is if you are suffering, particularly at night, is put a bottle of cold water in the freezer. Bring that ice bottle up with you to the bedroom at night, and if you are waking with pain, you can use it just to soothe the wrists. Okay, you can roll it over the wrist to soothe them. So the other thing that also might be helpful is contrast baths. So what that involves is putting the affected wrist or both wrists into a basin of cold water, leave it there for a minute, come out and put them into warm water, and repeat that for about 10 minutes, starting and finishing with the cold water, and that also can help to reduce swelling. That's something else that might be useful. If you really suffer at night, splints are recommended. So what the splints do is they help to keep the wrist in a neutral position while you're sleeping, okay? Because some women do sleep with their wrists sort of flexed as well or extended, and that can cause increased compression in this tunnel. So wearing these splints will help to keep the wrist in a neutral position, okay? So they are useful, and you can get them through your local physios or your local chemists. So we would recommend using them. Also, reduce repetitive exercises, okay? So things like typing, using a computer, using a phone, those kind of things usually might stir up your symptoms and aggravate them. So try to keep that to a minimum if you can reduce those activities, and that will also help. And one last thing that we do recommend, if you're doing exercise during your pregnancy, in the classes we do some exercises from a wrist position, okay? So we would recommend, instead of pushing off an extended wrist, okay, that does put a good bit of pressure down through the wrist, which is okay for women who don't have symptoms, but if you are suffering with symptoms, pushing off an extended wrist can increase compression in this area. So we would recommend, if you're doing any of these positions, pushing off the wrists, that you make a fist with your wrists and push up off the wrists in a neutral position, okay, so you're not increasing the compression in that tunnel. So those are just some useful tips that might help you just get through these symptoms. They will settle once your pregnancy is over and the fluid retention reduces. Thanks a million for watching, and if you want to watch more of our video blogs, please subscribe.